Well, there are people sleeping in tents, under tarps, and cardboard boxes across the country and right here in Saskatchewan.
The encampments are a physical manifestation of exactly how broken our housing and homelessness system is and exactly how far away people are from having their human right to housing realized.
That is the national housing advocate who says this is a human rights issue. Encampments represent a life or death crisis. And so today on Blue Sky, we'll talk about what we're seeing here at home. We'll talk to people on the front lines. And we have a national advocate who says we need to pay attention to this crisis and we need to act now. You can join the conversation by calling 1-800-716-2221. You can also email bluesky@cbc.ca. Now, back in November, our producer, Nicole Huck, was walking to work and she passed a man who was sleeping under a blanket on a piece of cardboard. And just for context, this was November, but there was snow on the ground by that time. And she stopped to check on him to make sure he was okay and ended up interviewing him. Here's their conversation.
A couple of nights I've been sleeping here.
What's your name?
Dana, Canopies.
Tell us a little bit about where you've been staying recently.
I've been staying outside all this time for about 2 weeks now. I stay anywhere where I can't get bothered by people. Like, I stay right down in downtown because of that people steal off you and take your blankets and stuff. Man. I got this. The lady gave this to me one night. And I was just sleeping on this. And
you were just sleeping on this piece of cardboard.
Yeah,
and you have a dog bed.
Yeah. And she gave me this blanket, and that's why I've been sleeping with this. It's warm, man. The blanket is warm.
And why haven't you been able to sleep in a shelter?
Because of fighting, the detoxes guy hit me there, and they kicked me out over it and barred me for good. Because of it, nobody really got physically hurt, but they barred me out of there. And my girlfriend, they stole a blanket from her and they wouldn't give it back to her, and we tried to make a complaint against them and they barred us for good for it. And it was her blanket too. It's like she isn't killed. She can prove that too, but we just couldn't prove it. They just kept telling there's nothing and we weren't intoxicated or anything. That detox takes people, that was last winter, takes people, if they're cold, they don't have to be drunk. As long as it's cold enough out there, they'll let you in. But they wouldn't give her back her blanket and we weren't drunk or anything. We were just needing someplace to sleep, and they wouldn't give her back her blanket. It was a really nice blanket that she had, and she liked it. It was her favorite warm blanket, and they wouldn't give it to her, and they just wouldn't let us back in there.
And then what about at the nest?
At the nest, I got into a fight there with a guy over alcohol, and they know that too, and I told that another place there, but it's right in front there. They have pods there, and that's where we got into a fight in there, and they barred me for it. And the guy's like younger than me too. I'm 58 years old and have arthritis and that, and we were fighting outside by the liquor store for that bottle, and then we got in a fight inside there, and I hit him with it. And I swear I have that effing thing, and then hit him with it, and it busted on him, and they barred me out, and I tried to go back to they barred me for life for it.
So Dana, you're kind of kicked out of all the places then?
Yeah, because of fighting and stuff like that.
And I mean, it's not as cold this week, but what's your plan when it gets a little bit colder?
I'll just find a shelter somewhere. I go sleep by the Four Seasons. There's a building alongside there where there's a windbreak where I go sleep. I was going there last night, but it was warm enough to stay out, so I stay here. So I stayed here for the last couple of nights. But when it gets really cold, I have to, I don't know, and I have a cast on.
Oh man, you have a
really
cast
cold,
too. Yeah.
It's really cool, yeah. I broke that, like, trying to jaywalk.
You got hit by a car?
I got hit by a car, yeah. And it was my fault too, and I didn't want to get the people in trouble by making a report. And I told her, just leave it, I'll be all right.
So, Dana, what do you want people to know about what life is like for you right now?
Life is just nothing. I just have nothing. I don't know what to do. I try to do things for myself. Like, I used to work and stuff like that, but I can't work because of my arthritis in my legs. And people have no understanding here about anything. Like, Even in Calgary, I've seen people kicked out of those places before, but they give them some kind of what's called, when it gets cold out, they'll let them back in till it warms up, and then they'll kick them out again. But here they don't even let you back in the buildings. But here they don't have nothing like that here. Like, I forget what they call it. I had to do something where they'll lift your bar for a bit till you come back in. They'll give you a place to sleep, they'll feed you and stuff like that. And once it warms up again, you got to get back out there.
So it's coming up to 9 o'clock. What's your plan for the day?
I'll probably just go to that friendship center on 11th Avenue and sit there. And they give you coffee in the mornings. They feed you a breakfast, like a little bowl of porridge, but that's about it.
And then, so you have a dog bed and you have a blanket and you have your recycling with you. What do you do with it all?
I'll cash that in. I'll use that for something to eat or drink coffee at night.
But what do you do with the dog bed and the?
I'll just take it and I go and stash it somewhere. Put it somewhere like where nobody will take it. The blanket I carry with me. I have a bag in it, but this I just go set it somewhere. Nobody really bothers it.
Well,
I didn't know that was a dog blanket. It was just a cushion to me.
Oh, I mean, yeah, for a really big one.
Yeah. I was covering up with this for a while, but I found this, and this lady gave me this blanket here a couple of nights ago. This is pretty warm. It's nice and warm.
Okay, well, thanks for sharing with me, Dana.
It's Dana Canapace in Regina speaking to Blue Sky producer Nicole Huck. That was back in November. At the time, he had been sleeping outside for a couple of weeks because he had been banned from some of the shelters for fighting. Dana is just one of hundreds of people across the province living in makeshift shelters. Some, like Dana, are alone. Others form camps where there's a sense of community and people can look out for each other. We've seen several of these bigger encampments in Regina in recent years. The homeless camp in front of Regina City Hall last summer was the biggest, with 83 tents at its height. That camp was ultimately dismantled by police after a fire broke out in one of the tents, and the city deemed it an imminent risk to safety. At the time, the Ministry of Social Services was on site to connect camp residents with services and with shelter. However, a ministry spokesperson said 47 of 49 people at the camp who had been previously offered shelter support refused or declined service. And we know from speaking with volunteers that many of those camp residents are still not in stable housing. Saskatoon also not a stranger to homeless encampments. It's something our next guests have a lot of experience with. So joining me in our Saskatoon studio, we've got Rob Garrison and Yvonne Raymer. Rob Garrison is the supervisor of the Community Support Program in downtown Saskatoon, and Yvonne Raymer is the assistant fire chief. Rob, hello.
Hello.
Thank you for being here, and Yvonne, hello to you.
Good afternoon.
Thank you. So, Rob, before we talk more about what you do on a daily basis, hearing a voice like Dana's, you probably meet a lot of people like Dana, hey?
That's pretty typical of conversations that my staff and I have with people every day. The only difference would be from what Nicole experienced is that generally we know the people, and we've been dealing with them for many times, many years, and they're still in dire straits, and it's a sad situation. Yeah.
So what is it that you and the other community support officers do on a daily basis?
Well, we're generally a foot patrol team, although in the summer we have a bike team, which has added a lot to our patrols. But we patrol in pairs of two in a very limited area, downtown Saskatoon, Broadway, Riversdale, and we deal with any manner of problems that come up. We try to keep the peace with people as we patrol. People will approach us. We're a very unique program in that the people that are vulnerable and that we interact with appreciate our uniform. They like when they see the red coat. They'll come and talk to us, and so generally when we know the people, it's easier to make those breakthroughs when they're in crisis.
How do you develop a relationship with people?
Well, I guess we have the luxury of having time. That's what we're doing. We're out there. Some people, a lot of my staff think that we have the best job in the world. You walk around and you talk to people, and that's what we do. You gain a good eye for problems that are arising. And like I say, when you know the people, it's a lot easier to pick out problems that you can help them with. We're generally geared for not solving their issues, but helping them to come to good decisions and seeking out the resources. And we have, a myriad of resources that we can refer them to. Although maybe we'll talk about that a little later, because the resources are dwindling in our books. But knowing the people and knowing their triggers and some of their actions, we have a very successful rate of success for de-escalating people, and that's what we get called for. We get called by businesses. Businesses have our phone number on speed dial, and they're the majority of our calls, because we care about business and we need them to be able to operate in this little bit of a chaotic time that we're in.
I have your number in my phone too, because I've come across people and I've been unsure if they need a bit of help, and I know that your crew can walk by and check on folks and make sure that they have what they need. How many people that you're dealing with, Rob, would be living on the streets? When we talk about encampments, I think people have an image in their mind of what that might look like. But what do you see in your work?
Well, we were talking a little bit before. It's changed. There's a lot of people out there who I call them gatherers. They spend their whole day trying to find food and trying to find shelter and support. We help as much as we can, but we're a small team. And it's when we see them in the end, sometimes they'll be in crisis and we're not around, or we can't help them. Their resources aren't available. That's when things happen that emergency services are needed, and we think that we have a good success rate for helping that area, as much as we can. We're a small team.
Yvonne Raymer, as Assistant Fire Chief, what's your sense of how people are getting by? I know what I see, and there are things that I'm seeing that I didn't see 10 years ago when I first came to Saskatoon. I was telling Rob before the show that I take the bus at 6 a.m. sometimes, and I'll get off at 1st and 20th, and I walk in front of Midtown. And there's somebody who's definitely set up a bit of a shelter out of cardboard boxes, and he's in the corner, kind of right in the corner of the Bay building. And I can see why, because there's a vent. He's blocked from the wind, and I think there's some warmth there. And I didn't see that a lot when I first moved here, and I see this all the time now. So what are you seeing as Assistant Fire Chief?
So when you talked about the centralized encampments in Regina, it became a concern here in Saskatoon. Saskatoon Fire does have a responsibility under the Property Maintenance Bylaw and under our Fire Safety Act, a duty to mitigate risk. So it was concerning when we came out of COVID. We did notice more unhoused individuals. I can't go back in time and try to figure out what exactly happened during COVID, but we definitely saw a rise in numbers. So November 2021, we changed our process. We told our inspectors we will treat the unhoused the same as we would if we have to close an unsafe structure, such as city center or after a fire. Treat them with dignity and respect, but also offer them that rehousing piece. But also, if they don't want rehousing, let's build a relationship. Let's find out why. Let's find out what's fitting, what's not fitting, what's the solution at their state of readiness, not at ours. That was sort of that step back. So in November, it was over 100 interactions in 2 months. Took us a little bit by surprise. And then
when you say interactions, you mean like people who've set up a bit of a shelter. They're living either by the river, or, and you're having a conversation with them, and so you know that they are living outside.
Yes,
Yeah.
these interactions are those that are not within a structure. And it's 2 fire inspectors that are dedicated. We call them the unhoused team, the unsafe and adequate housing team. And it was surprising to us in the first 2 months, there was over 100 interactions. We'd had a couple fires. So we actually created a way to document any unsafe conditions, whether it's overdoses or anything else happening around the encampments. And last year, we had 1,020 interactions, and we actually had to split apart our team in order to double down. And during for our working hours and conditions for our inspectors, we actually had to turn them into a 4-on, 4-off. So some of our inspectors are no longer Monday to Friday. We are actually 7 days a week other than public holidays, because we identified that on a Monday we would be inundated with requests for support for the unhoused. And so on Saturdays and Sundays we now have inspectors that are available to address some of the unhoused. We'll see what 2024 brings. And like Rob said, some of them they won't take support. Some want to engage. Some we offer the supports. We make connections to supports. We do know the gaps and the barriers in some of the systems. We're trying to navigate through that to try to get them connected. This winter was the first time we had an overnight warm-up location, and that made a huge difference. But it was alarming, the numbers that St. Mary's Parish was seeing. You know, on a regular basis, they were seeing over 100 people accessing a warm-up location overnight, so that they weren't out in the freezing cold.
Why do we sometimes see makeshift camps? I've seen it outside of the Salvation Army, you know, and I know, people outside of the Wellness Center when it was located downtown. I saw people who were sleeping outside, and that was a choice that they were making. We heard Dana's reasons. He had been kicked out of shelters in Regina. I know along 20th, Prairie Harm Reduction, we go by there frequently, and I see people who have set up camps. Why those locations? Like, why outside of what is supposed to be a safe shelter?
A lot of them, when you talk to them, they do want to access shelter, but they're full. And I do feel for Dana. We identified this with some of the organizations that are there to support, in that there is actually a rule amongst the shelters that they cannot be banned from all of the shelters at one time. But how do you communicate that to somebody who's unhoused and doesn't have a cell phone? How do they know that they could actually access one of the shelters? To them, they know they've been kicked out of all of them. They don't know which shelter is now allowing them to come back. Really what they do is they put them sort of on reviews. They go decompress, and then they're allowed back. So there is a moment of review, but they are not supposed to be banned from all of them. But my thing was, how do you communicate that? And if they are not hanging outside of the shelter waiting, they may be somewhere. I mean, we have 66 neighborhoods in this city, and last year in 60 of our 66, there were unhoused individuals. How do you find those individuals to say, hey, you can now access shelter, you're no longer on review or banned?
Rob?
I could just add to that. We have... last winter it really came about, but actually this winter too. It's not as cold this winter. But my staff in the evenings trying to find accommodations or some solutions for the Danas of the world that are hard to house. And then we always think, you know, some of my staff say, you know, I'm making 15 phone calls in front of this fellow and everybody's rejecting him. And that's not improving things. That's not improving his sense of dignity and his self-worth. So it's very, and, you know, plus the staff are out there in the cold making all these calls. And like Yvonne said, maybe it would be better if we had some way of communicating, some process for communicating so that, people can access quickly, because we're a small team in the evenings when it's cold and the cold weather strategy is on. There's other people to help. And my staff always look at it as a failure when we can't find a place for the Danas, because they're not always violent, we a lot of times something happened when they're intoxicated, but maybe this time when we're dealing with him, he's promising to behave. But we also understand the staff issues at the shelters, because they need to be safe too.
Intoxication. I just want to ask you quickly before we check in with our newsreader for the headlines today, but Intoxication, this is not the first time I've had this conversation with people, and I've learned over the last several months and years that often people will use at night to stay awake, to keep themselves safe, and then they'll find a place to sleep during the day. And we know how toxic the drug supply is right now and how much people are struggling with drug use. So how is that complicating this whole thing, Yvonne?
Well, the overdoses are definitely on the rise. You see year over year the trends. We now have the overdose outreach team. It's in partnership with SFD and the SHA, and reaching out to these individuals. It is prevalent in the fact that they feel isolated. There is no place for them to go to decompress or to warm up or feel safe or to use. And I understand the shelters, why they don't want them using when you have others that are going through programming and they want out of that. So, currently there really is no solution for that situation, and the concern that we have is when you're using at night, you don't get that natural surveillance. So if you overdose, and because you've used, you may be at risk of freezing to death because you've overdosed, you're unconscious, and there isn't the activity, the natural surveillance in the daylight that you see. And I think that's why a lot of individuals, and when talking to them, they feel safer sleeping during the day. There's less likely to have their blankets stolen, less likely to be harmed because people will call for help on their behalf.
Rob, I'll quickly let you elaborate.
Yes, and that's become a big part of our day is, some people refer to us now as the bathroom police because that's where people are going to use. Women are going there to rest, to get away from the problems that are out there. There's a big lack of beds for women. Safe beds. And when we hear their stories about why they won't even go to a warm-up location at night because of their fear for their safety. And we know what people are dealing with. They're dealing with generational trauma and issues that we need to help them with. We feel bad taking them out of the washrooms, but they're in there. Businesses need to operate during the day, so we need to find solutions, and I think it's time that we do.
Okay, well, we're going to keep talking about this. Today we're talking about encampments. This comes after strong words from the National Housing Advocate, who calls this a human rights issue and that we need to address this, and has several calls to action that she hopes are implemented by August. Our guest today, we've got a few people and some people joining us a bit later, but we've got Rob Garrison here in our Saskatoon studio. He's the supervisor of the Community Support Program in downtown Saskatoon, and Yvonne Raymer is the assistant fire chief here in Saskatoon. I'm Leisha Grabinski. This is Blue Sky. We welcome you to call and join the conversation, 1-800-716-2221. You can also email us, bluesky@cbc.ca. A couple of emails. So Keith writes, one of many solutions for the housing shortage and homelessness is to build tiny homes in a tiny home subdivision instead of waiting for contractors to build normal housing. And Robert writes, in past decades, Sask Housing maintained a large stock of rental units for lower-income residents and seniors. A few months ago, there was a report that there were thousands of vacant Sask housing units across the province. This seems to have fallen out of the public debate. Have these units been brought back into service? If not, why not? Now, Yvonne Raymer, I don't know if you can answer that question specifically, but when you look at where people are able to go, we've talked a lot about shelters so far this half hour, but to get people into stable housing, and I know this is very complicated and very difficult, but what's your sense of what is available for people in this city? Is there housing available? Are we making use of everything we've got?
The stats that I have seen, the vacancy rate is at its lowest and the rent is at its highest. So when we look at the interest rates, our economy and the cost of everything, rent is rising. So I'm hearing more and more, even our elderly people are not able to afford to maintain housing, not even to maintain rentals. So it's becoming very difficult. We have the lowest vacancy rate, and then we also have the highest rents we're ever going to see. One of the things that SFD is doing is we're at the very preliminary exploration stage of looking at a bylaw that would address incentivizing vacant properties. How can we restore that building stock? How can we have it back to affordable housing stock instead of letting it just sit there? So, but that's a lot of work to get a bylaw up and going and doing that exploration. So it is concerning that we don't have enough building stock to rent currently.
The other phrase that we often hear is that some people are hard to house. They might have mental health issues. They might be struggling with addictions. I mean, even just hearing from Dana, he's in a cast right now, like things are complicated. And I think what the National Housing Advocate has said and others is it's not always just about housing stock, right? It's so much more than that.
It is, and some of them need supports. They need built-in supports to help them navigate through housing and to stay warm, stay sheltered. But they don't need to be in an emergency shelter all the time, but they do need that support. They need to know how to manage their addiction or their mental health issues, how to maintain a house. Some of them don't even know how to take out the garbage and do some dishes right now. They're living day to day. And as I said, he's going out looking for recycling. He's worried about staying warm and getting the next meal. That's a full-time job for them.
Mm-hmm. Rob, what do you think people need to feel supported and to get on a better path?
Well, there's a lot of people doing very good work in Saskatoon. We have to acknowledge that. And some of these people that are hard to house have been housed. They've had that opportunity, and like Yvonne says, they couldn't function alone. So we always say, and experts are saying now that we need programs where they have these wraparound supports, and they have these people don't ask much out of society. They really don't ask for much. And I think that housing them in a place where they can build and grow and feel better about themselves and have a better quality of life. If anybody ever wants to see a program that's working in Saskatoon, and that, in my opinion and our opinion from community support, should be expanded, is Edwards Manor. They have exactly what we're talking about and more.
The wraparound supports for people.
Exactly.
They're living with a substance use disorder, but they're supported to...
Yeah. If you had 3 of those buildings, it would eliminate a lot of issues that we're talking about today, because it would be a viable option. Putting people that are not capable of living alone into a housing situation is, it's good for a day. And then all of a sudden we're meeting them on the street, and I had so-and-so over, and and so we have to realize that people they have deeper issues that they need to address, and housing shouldn't be one of them. They should be safely housed so that, at Edwards Manor, they also have cultural programs and elders and employment programs and resume writing and all the good stuff that we talk about. So
if people could see the assistant fire chief nodding along here, you obviously are in agreement with Rob. But why not? Why? It seems like that you're not the first 2 people to bring this up on a CBC radio program about how the model of Edwards Manor works. What is the holdup? What are the barriers?
I think that's the $1 million question. But I think that when I look back from our lens, and we have a close relationship with police, the community support officers, and when we look at the cost of the resources for the frontline staff that go out to address some of the social disorders, some of the violence, the overdoses, the medical emergencies, the fires. Last year we had 43 fires. When you look at the amount of resource that it takes, and then you look at the operating cost or the capital for an Edwards Manor, I, too, ask, why not? It's better to have them safely housed, safer for community, it's safer for them, and it's better outcomes, I think, for everyone. And I'd really like to provide all the costing and see what would be more cost-effective, and I would bet my paycheck it is Edwards Manor and more homes like that.
I can just add further to Edwards Manor. They're a great organization. The people that they house there, we can safely attest to the success of that program, because a lot of people were generating a huge amount of calls for us, and like Yvonne says, emergency services. Mm-hmm. Now they have a nurse that visits, and they manage their medications. They have a nurse practitioner that comes once a week. They're getting their health issues addressed, so that because a lot of the people we're dealing with and Yvonne's dealing with, the only health attention they get is from the back of an ambulance, and they're going to the hospital to clog up. Mm-hmm. If we spent a little bit of money, like Yvonne says, it's got to be cheaper.
I'm sure that our next guest, Michelle Biss, who's the National Director for the National Right to Housing Network, will have thoughts on this. But before we get to her, we do have a couple of callers on the line. And so Linda from Moose Jaw, who happens to be on the road right now, joins us right now. Hi, Linda.
Hello there. Thank you for this program because I think this is fantastic. I'm clergy. I won't say which denomination. Currently, I'm not working directly in a church, but I work in a small community in Saskatchewan. And just this morning, as I was coming on my drive, walk into a grocery store in Moose Jaw, and like a convenience one, and there's this young girl standing crying in the vestibule with no heat. It's minus 19. It's like 9 o'clock in the morning. And I said to her, are you okay? And she said, no, I'm not okay. And of course, I can't pass by these people because of my calling. I can't walk by. So in conversation with her and the business owner, trying to phone support, I know we have Riverside Mission in Moose Jaw, but it's for men. I know about the other things because I'm involved in them, and it's like, yeah, there's nowhere for her to go. What about John Howard? Can I take you to John Howard? So I ended up taking over there, but before I said, when was the last time you ate? And she said 2 days ago. And
a few days ago.
Can I buy you something to eat? 2 days ago, yeah.
2 days ago. Mm-hmm.
Yeah. She wasn't sure because she couldn't think. Right? She's addicted. There's all these things you're saying, right? Is this a housing problem? In my opinion, no. It's not a housing problem. We have a trauma problem. And all those children all over the world, including in Saskatchewan today, that have trauma in their upbringing, that are neglected, that are left in the social system, which she told me about on the way over to John Howard. She said there's so much trauma in her life, they don't know where to start. She's 33. She was a model at one time. I mean, we can't look at this problem, and I agree that this Edwards house, because we look at these people like it's a housing, it's not a housing problem. It's a human problem, and it's one that we're ignoring. So I thank you for this program. I think the thing you're saying is good. The other thing I'd like to see is the data. You said 100 interactions and 1,000 interactions, right? How many of those 100 and 1,000 are like, so it's 1,000 interactions with 100 people, or 1,000 interactions with 1,000 people, right?
Yeah, good
we
question.
need more data.
Hit your mic
Yeah,
there,
and thank you for that. Actually, we do track and map the WHO when we recognize them, and so it's 366 people last year that we interacted 1,020 times. So thank you for that. We do track a lot of data. I could almost send out about a 32-page report just on the data around the unhoused right now.
Well, we're getting a sense of it. I would like to thank you, Linda, for calling. And I know we've got another caller on the line, but I do want to say hello to our next guest. So Michelle Biss is the National Director for the National Right to Housing Network. She's been listening in to today's program and joins us now with some of her thoughts. Hi, Michelle.
Hi, Leisha. How are you?
I'm well, thanks. What are you itching to say in a moment like this?
It's tricky, right? Because when I look at the Federal Housing Advocates report, and when I go through this report, I'll communicate that when she created this, it was part of the National Housing Strategy Act. It was part of her role as a human rights accountability mechanism. So her role is to receive systemic claims, investigate them, work with people in communities, and then come out with recommendations based in Canada's human rights obligations. It's all about bringing human rights home. But her first issue she's picked is on encampments, and it has taken her so much research. She's gone to encampments across the country. She's talked to people in municipalities. She's talked to federal government. This report is, I think, the culmination of so much engagement and thinking work. And I really want to make clear in the conversation that, when you see an encampment, it's because it's that person's best or their safest choice. You're seeing people's attempts to survive. And so, as we center in the discussion and talk about all the different options, I do think it's really important. However, we talk about the solutions around homelessness and the manifestations of encampments, we're really centering people's human rights, and we're really centering their dignity, their autonomy, because under human rights, they have autonomy, they have dignity.
And with that top of mind, I do want to ask you about the concerns that people have with encampments, the concerns around safety, the worry, the fear, and the incidence of sometimes sexual assault. We've had people overdose in encampments. And I know City Police in Regina did dismantle one, and of course, a lot of attention on Edmonton these last few months. And so I'm just wondering, your thoughts on some of that and some of the safety concerns that are raised by people about encampments.
Yeah, I mean, I've certainly heard that a lot. I mean, but I think you have to kind of back up and ask yourself the question, why is someone living in an encampment? The reality is, I think that shelters are notoriously underfunded. I would argue that a lot of frontline staff in shelters are really burnt out. They're really under-resourced. And the reality, we heard from Dana earlier, you might go to a shelter one day and then get kicked out the next day and then return to that shelter and not find housing. And the only way really through this to figure out what is causing this is to meaningfully engage with those people who are encampment residents, but in those conversations center their dignity, shelter their autonomy, because the option for people in encampments shouldn't be you either live in an encampment or you go to a shelter. Some of this goes to the core ways that we can fix Canada's housing crisis. We can massively scale up social housing. We can address inadequate social assistance. We can ensure that there are security of tenure protections so people aren't evicted into homelessness for totally preventable reasons. But at its core, we have to ask folks, why are you living in the encampment? Why aren't you considering other options? And are there other options available? Because the report from the Federal Housing Advocate, it's not about entrenching encampments, but it's about respecting people's human rights while we look for those long-term solutions with total urgency.
I want to play people just a little bit from the National Housing Advocate, Marie-Josée Houle, because she did do an interview with CBC's David Cochrane on power and politics, and he's asking about shelters and why not, because I think the Edmonton police chief did say, well, there was shelter space and people are choosing this. And I just want to dwell on that just a little bit more to help people kind of understand what's going on there. So let's listen to Marie-Josée Houle's answer to the questions on this from CBC's David Cochrane on power and politics.
Why do you say that?
Because people are dying. That's really what it boils down to. People's human rights to dignity, to the basics of survival are not being met. And also in 2019, Canada enshrined the right to housing in domestic law through the National Housing Strategy Act. And the encampments are a physical manifestation of exactly how broken our housing and homelessness system is and exactly how far away people are from having their human right to housing realized. It's also an Indigenous crisis.
Mm-hmm. Right. We see a lot of Indigenous people without homes living in these encampments. Is that what your point is there?
That's right. There's an absolute overrepresentation of people who are Indigenous living in encampments, who are experiencing homelessness and housing precarity, especially west of Ontario.
And Michelle, I will ask you a bit more about that, the representation that we see here in Saskatchewan and, like she said, in Western Canada especially. Here she is, though, Marie-Josée Houle, talking about shelters more specifically.
We spoke to Jason Nixon, who's the minister responsible for this in the Alberta government. We heard from police officials in Edmonton that there was capacity in the shelter system, and people were choosing to stay in the encampments rather than go to the shelter system. How do we reconcile that? That if there is space in a shelter system, is that not better and safer than a tent encampment in a Canadian winter?
Well, I'm not the person you should be asking. You should be asking the people who are choosing to stay in encampments and not going to shelters.
You said in your answer, a shelter is not the answer. So explain to me why a shelter is not better than an encampment.
Well, because people who are experiencing homelessness are expressing that they don't feel safe in a shelter. You're sleeping next to strangers. There's no privacy. They do not, a lot of them are geared towards men. A lot of them are co-ed, where women don't feel safe. People who are transgender also experience a lot of violence. So a lot of the things that happen in encampments that make the public very uncomfortable also happen in shelter, except that you're not choosing who you're sharing your space with, where people in encampments quite often are, and they will find community together and they will find safety together. So this doesn't happen in a shelter setting.
It's the National Housing Advocate speaking to the CBC's David Cochran, just further unpacking what we're hearing from Michelle Biss as well, who's the National Director for the National Right to Housing Network. Michelle, I want to give you the opportunity, and our guests in our Saskatoon studio as well, to just talk a bit more about the representation that we're seeing, the number of Indigenous people who are facing homelessness, who might be living in encampments. Michelle, does that line up with some of the research you've looked at and what you're seeing, especially in Western Canada?
Oh, yeah. I mean, disproportionately, Indigenous folks are represented in homelessness populations. I think there's data for Saskatoon, and local folks might correct me on this one, but from my research, 90% of those experiencing homelessness in Saskatoon are Indigenous. In Regina, my understanding is it's 79% of the homeless population, and in Prince Albert, 99%. And I want to align this conversation and comment on something that Marie-Josée Houle said there. That sometimes the conditions in a shelter might be what folks sometimes call carceral, right? You might not be able to bring in your partner. You might have very strict visitor rules. Can be a real sense of community in encampments, and going to the core of this, if we're really looking at root causes and we're thinking about ways to support people experiencing homelessness, then the question is, why aren't there more and better housing options? And then there you have to zoom out and you have to look at the housing crisis as a whole and the way that we have really failed in terms of creating Canada's housing policies. And we keep seeing cuts to existing programs. I know that's something that is existing in Saskatchewan, I think pretty significantly, rather than an investment. And I think with one of at least the top two biggest crises that are facing Canada, which is the housing and homelessness crisis.
Mm-hmm. Yvonne Raymer and Rob Garrison, hearing those numbers again, they do line up. What Michelle said lines up with some of the reporting we've done in the past about how disproportionately Indigenous people are represented in that community of people who are struggling to find stable housing. Does that line up with what you're seeing?
It does, and I think Rob might agree or disagree with me. We also, our city's kind of unique with the river running through it, so it's east side, west side, and there are different reasons for unhoused on the west side versus the east side, and a lot of those individuals will not come over to the west side to access services because they have different concerns.
What would be their concerns? I don't know much about that.
There's some gang activity. They may be alcohol driven and they're not drug dependent, what we call IV needle use, and their fear is coming over and being preyed upon and not being prepared for that. There's different tones and rhythms to the unhoused, and there's actually, I would call a hierarchy amongst our homeless as well. And she's absolutely right. I mean, some of the shelters are not set up for their needs, for their uniqueness of there may be a couple, there may be, somebody who's identifying as male or female and they don't feel comfortable. I think, Rob, you probably agree. I was alarmed last year the amount of females now that are homeless has dramatically risen, and we're seeing a times 4, times 5
Yes,
increase.
and that's the majority of our, as I mentioned before, our bathroom calls. 3 or 4 women getting together for safety and using the washroom, and when we talk with them, they're showering in there, they're washing their clothes, I've washed my hands. And it takes a long time, and other people need to, so there's a bottleneck there, and we're trying to work through those issues. It's mainly the libraries and Station 20 that get really overused in the washroom area.
And the human trafficking is becoming concerning too for women. That's their way to survive. I'm not from the police, but in having those conversations, that's the hard reality of what they're facing, is that in order to be housed maybe for an evening, they have to traffic themselves out, or maybe they're being trafficked out. So, there's some tough conversations and some real traumatic reasons why these individuals are, quote unquote, hard to house.
Yeah.
A story that happened last winter over and over and over is we asked them, women, why didn't you go to the shelter last night, or why didn't you go to the warm-up center? Well, because they've had occasions where they fall asleep and they wake up and some guys are wrapped around them. That's reality. And they tell us that. And I don't doubt it, because there's, as your guest was saying, they're underfunded. There isn't people there that are trained to watch for these kind of things and to know that there's some unsavory people that are also seeking shelter, and we have to protect people. And again, it comes back to wraparound services. If you're going to open a shelter or a warm-up center, you need the staff and resources. You need people trained.
Michelle, this is exactly what you were alluding to. Hey.
Yep, exactly. I mean, you need to look at the core causes. You need to look at the core causes. I mean, the example of people, waking or experiencing abuse in shelters. I've certainly heard a number of those stories. But like at its core, when we zoom out of this report, and the reality is we're not investing in adequate housing. We're not investing in affordable housing and what the long-term housing solutions are. And so I think a lot of folks have been asking the question, why is the federal government coming into this when usually we have conversations about encampments more at the local level? And I think part of the issue is that, and I'll say this as a national advocate, a lot of these conversations around encampments, a lot of the prevalence of encampments as a demonstration of the exacerbation of homelessness across this country, these conversations are happening in communities across the country, but there's a real federal role here as leaders to step up and say, okay, let's all come to the table. And what Marie-Josée Houle has asked for in her report, her primary call to action is for a federal response to encampments, for a plan. And in fact, she's given Minister Sean Fraser, the Minister of Housing, Communities and Infrastructure, a deadline of August 31st to
Which is
assemble
not that
plan.
far away when you think about it.
It is not. It isn't. But, like this housing crisis is the worst crisis that this country is facing. And I think if you ask folks who are living in encampments, who are making, struggling day to day to survive, they might say that's not soon enough for me to get to the table. And we saw, there's an example, I think, fairly recently, there was a federal government action to convene a roundtable on the car theft issue that's very big right now. That came together in a snap. So let's prioritize homelessness in the federal government's mandate. Let's prioritize this, get folks to the table and talk about what the problems are with our housing system and what the problems are that we can address immediately to make sure people experiencing homelessness have good options that respect their dignity.
Well, I know more about this than I did an hour ago, so I just thank all three of you so much for being with us today. Michelle, thanks for being one of our guests.
Thank you so much.
It's Michelle Biss, the National Director for the National Right to Housing Network. Also, Rob and Yvonne, thank you for being here with me in studio. I really appreciate this.
Thank you.
Yeah, thank you.
Yeah, you both do important work.